Time now for today's house call. So we've talked about the signs that you have the flu. We've talked about what to do when you have the flu. Today on House Call, we're talking about what to do when it's not you that has the flu, but somebody in your family, maybe even a child. Not only are you taking care of them, you're trying to keep them from spreading it to the rest of the family. Melissa Morgan is here to tell us more about that. She is the Senior System-Wide Director for Infection and Prevention and Sterile Processing at Cone Health. And if anybody knows how to not spread something, that would be her. Absolutely. For sure. So, I mean, you do everything you can to keep it from spreading. But it does. It does. So what happens when, you know, someone in your family gets the flu and you don't want it to go to anybody else?
So the things we talked about on Wednesday, making sure that that person stays rest and recovered, and actually keeping them away from the rest of the family. So kind of quarantining them to their bedroom so that you encourage that rest and recovery, but then also remembering what spreads the flu. So it's a droplet virus, and so things within 3 to 6 feet, much as we are sitting here, is the easiest way to spread. So reminding them about that Dracula sneeze and cough is a key way to help them reduce the spread, and then also cleaning. So any household cleaner that you use that has a label that says it kills common cold and virus is effective, and cleaning those common spaces such as doorknobs, handles, things that are commonly touched will help eliminate that spread.
So what if you're the caregiver and you have to go, it's a child per se, and you have to go in, you have to take care of that child, you have to do things for them. How do you protect you?
Well, the #1 way to protect yourself against the flu is actually the vaccine.
Well, yeah. That's true. That's very true. And it's not too late. People say, well, I forgot to get it. It's January. It is not too late.
No, Cone Health medical providers are always offering the flu vaccine during the flu season. And so it is never too late. You can still see them now, even if you have a child that has just come down with the flu. So you are able to get that vaccine, which is the #1 way to prevent infection, and then also by washing hands. So hand washing, even with alcohol-based sanitizers, will protect you from the flu.
And wiping down the areas that the child or the sick person is in, including the sheets, because sometimes we don't think about, you know, the sheets and the pillowcases and all that. You have to wash all that too.
Yeah, so just basic household chores, right?
Yeah. That we love so much.
Absolutely. So washing sheets routinely, making sure your environment is clean and that you've used good household cleaners to do that.
And a lot of people say, well, you know, it just sounds like common sense. That's true, but sometimes sense isn't that common.
Well, when you're dealing with a sick child, you're very distracted.
Right.
And so also you need to remember to take care of yourself. So making sure you're getting a nutritious meal, that you're doing things to reduce stress, and that you're getting enough sleep. Because oftentimes someone that's sick, especially a child, wants mom, wants dad, grandmother, and wants you to cater to them.
Right.
And so if they're up coughing all night, you're up all night.
Absolutely, absolutely. Thank you so much. Been great spending the week with you.
Absolutely.
Good information there. If you want to find more tools and resources to protect your family, check out conehealth.com/flu.
House Call on Fox 8 is sponsored by Cone Health.
After